Today we discuss an important topic. I only discuss the clinical aspect of this disease, that is cavernous sinus. There are many pathology of cavernous sinus, and it is important for dental student, for neurology student, and the medicine student. So let's start. So cavernous sinus is a venous sinus. It is actually a dural venous sinus, and the dural venous sinus is situated between the meninges and also the skull. In between these two layers, it is actually a balloon structure. Cavernous sinus is actually balloon structure, and it receives blood from the face and also the superior part and some meningeal branch. There are many branches of cavernous sinus. I do not discuss a detail about that because it is most important in case of anatomy lecture. So, but here two important branches is necessary. One is ophthalmic branch because it drain the venous drainage from the ophthalmic division of face, and also there is facial veins. It actually drain the vein from the inferior part of face. Now, what is the clinical importance of this? When there is an infection in the face, mainly the sinus infection, and also an infection of the ophthalmic, an infection of the area drained by ophthalmic division, also the inferior part, that is dental infection. So it goes upward. And one thing is also important, that is this venous drainage has no valve. So any infection that goes up, it goes through the cavernous sinus. So if anybody suffering from sinus infection or dental infection or the face infection, if that pathogen goes to the blood, then it traverses through the cavernous sinus. And it is also another important that these things has vast importance on clinical eye development, because when I discuss this later part. So here is the anatomy. You see, this is the vein. So you see, this is the cavernous sinus, and in its medial part there is internal carotid artery and abducens nerve, and in its lateral part there is trochlear oculomotor nerves, and also the maxillary and ophthalmic division of trigeminal nerves. So it is a complex structure actually. There is so many things within this 2 into 1 cm area. The area of cavernous sinus is actually 2 into 1 cm. So if anything occurs in this area, this surrounding structure at first involved. So we can got the ophthalmoplegia, we can got there is also surrounding the internal carotid artery, there is also sympathetic tongues lies. So if any pathology in this area occurs, we can also found Horner syndrome, because this superior sympathetic ganglia supply the ciliary ganglion, and it's involved the pupil. So all of the findings, it usually involves the eye. So there is ophthalmoplegia, and also the pupillary constriction we found. So let's see, it is the venous drainage area which show in this diagram. We can see that we have two important vein. One is inferior ophthalmic vein and another is facial vein. These two veins drain into cavernous sinus and then goes into pterygoid plexus and then into the other venous drainage. This is not the topics here. So facial vein and inferior ophthalmic vein is too vast important to know the pathology of cavernous sinus. So this is also the diagram showing the cavernous sinus and other dural venous sinuses of the brain. So, what complaint patient usually do by suffering from cavernous sinus? So, at first we form the differential diagnosis to know about these things. And what are the sign symptoms of cavernous sinus pathology? I already discussed about that there is a ophthalmoplegia and it is a venous drainage area. So it is it is a have nociceptor. So patient also complain pain by suffering from venous sinus pathology. And usually it is unilateral because almost all the pathologies goes through one side, but there is connection between intercavernous sinus. There is connection. So bilateral involvement can also occur, and sometimes the patient complain of unilateral symptom first and then the bilateral because there is connection between two cavernous sinus. So what are the pathology? What are the differential diagnosis? It is a small structure. So there can be in young age there can be venous sinus thrombosis. And what are the cause of venous sinus thrombosis? The venous sinus thrombosis can be due to local cause or can be due to systemic cause. In case of some blood malignancies such as leukemia, lymphoma, the tissue, the blood cell aggregate there. So the chance of forming clot it increase in case of leukemia and lymphoma locally. And there are some other cause of venous sinus thrombosis, some systemic cause. In young age we can thought about protein C, proteinase deficiency, and vitamin 3 deficiency, factor V bleed mutation. But these diseases are very rare in our country. But one thing we cannot forget, that is ACLE and antiphospholipid syndrome. This is very common in our country. An young female usually suffering from joint pain, skin rash, and other fetal loss. So, and other things also polycythemia rubra vera and also the myelofibrosis. It is more common in relatives. So there is a predisposing factor to forming the venous sinus thrombosis, such as oral contraceptive pill use, and sometimes some drug history is also important. So this is the cause of venous sinus thrombosis. And presentation of venous sinus thrombosis and other venous other cavernous sinus pathology is usually the same. All of these things look like same, but there is some differentiating point. How can we get differentiate? So we should know other differentials. So there can be localized tumor. The tumor of surrounding structure, such as it can be meningioma, it can be somonoma, it can be surrounding tumor, such as cavernous sinus, such as cavernous sinus malignancy can also be occur. So pituitary malignancy sometimes forming a differential of cavernous sinus pathology. And one thing is important in case of pituitary macroadenoma, it usually present with visual loss, the visual field loss. And if this tumor involves the cavernous sinus, it present earlier because of other symptoms of cavernous sinus such as ophthalmoplegia and retroorbital pain and chemosis and proptosis. And another thing is carotid cavernous aneurysm. And sometimes this, you know already, the carotid artery tapered through the cavernous sinus. So if there is any trauma and if there is any aneurysm of the carotid artery, and somehow the wall of the carotid artery is ruptured, and it make a communication between cavernous sinus and the internal carotid artery, the canal part of the internal carotid artery. And this communication can be by two pathways. One is direct and another is indirect. And the indirect communication is usually occurs the remnant, the infantile remnant of meningeal artery or the carotid artery, and so the cavernous sinus. So the direct, if the communication become the direct communication, it is usually present acutely and more severe, more aggressive. And chronic type is usually it is a submissive form, and patient it occasionally heal spontaneously. So patient cannot present acutely, and there is no emergency situation in case of type B or indirect communication between the carotid artery and the cavernous sinus. So there are other sign symptoms of cavernous sinus involvement, such as the ptosis and the conjunctival conjection or injection, or we found the red eye, and sometimes patient present with visual loss also. So we already discussed about the cavernous sinus thrombosis, and the thrombosis of cavernous sinus can be occur due to infective source, such as any pathology of the paranasal area, paranasal sinus, and also the dental or orbital infection can spread through the cavernous sinus. And some pathology also, it is usually rare, such as Toloso-Hunt syndrome. Toloso-Hunt syndrome is nothing but although the actual pathology of Toloso-Hunt syndrome is unknown, we thought that it is usually due to granulomatous inflammation. So there is a granuloma. What is granuloma? It is nothing but the collection of inflammatory cells such as eosinophil, lymphocyte, basophil, and other inflammatory cells, and epithelial cell. So the inflammatory cell make house within the cavernous sinus, and the patient present like cavernous sinus thrombosis or other cavernous like pathology. But one thing is important here, that is it is response to steroid. This is very good thing. If you make the diagnosis of Toloso-Hunt syndrome, the treatment is very easy. So other granulomatous disease such as sarcoid or organ granulomatous disease can present as a Toloso-Hunt syndrome. So Wagner is a midline granuloma. It also involves the lungs and also the kidney and also the paranasal sinuses. And it is a usually rare disease. And sarcoidosis is a systemic disease. It involves many systems, including lungs, and in the skin we found erythema nodosum, and patient can present with breathlessness and some joint pain. And in the brain, the sarcoidosis can present as pachymeningitis, or it involves the meningeal layer. And sometimes it involves the cavernous sinus. So cavernous sinus involvement, one of the cause of cavernous sinus involvement is sarcoidosis. It is rare cause, but sometimes involved. And the common cause is not found, then we think the rare cause, such as sarcoidosis, Toloswan syndrome, and Wagner granulomatous. So, what are the findings? We can found in by examining. We already told about the ophthalmoplegia and ptosis, and there can be a combination of honor, ophthalmoplegia, ptosis, proptosis, chemosis, and retroorbital pain. There can be a combination of all these things. In one patient, you cannot found all the things, but there can be a combination of all those things. And one of the rare findings is pulsating exophthalmos in case of caroticocavernous fistula, because there is communication between the internal carotid and the cavernous sinus. So the pulse is transmit in previously it is transmit only the carotid artery, but there is a communication. So you see the pulsation. You see the pulsation of proptosis eye in case of carotid cavernous fistula. It is a very rare finding, but it is found in case of carotid cavernous fistula. And you can find the other things of primary disease. If there is a intracranial tumor, such as pituitary tumor, you can find the visual loss, galactorrhea, and other features of ectomegaly. And if it is metastasis from the, usually the lung metastasis is common, and there can be other metastasis, but the lung metastasis is common. So if you found the primary organ sign, such as cyst findings in case of bronchial carcinoma. So in long term, so in case of other tumors such as meningioma, neurofibroma, chordoma, lymphoma, this is a very rare thing. But meningioma and neurofibroma is usually common. So you can found that tumor focal sign, which is part of brain involved. Other than cavernous sinus, you can found that focal sign. So, in summary, what are the presentation? What are the presentation of the patient? They present with ophthalmoplegia, visual blurring, eye pain or retroorbital pain, proptosis, chemosis, and what are the cause? What are the common cause of cavernous sinus? The common cause is cavernous sinus thrombosis, cavernous sinus tumor. It can be primary or secondary, and it can be due to some rare cause such as caroticocavernous fistula or Toloswan syndrome, or some very rare cause such as sarcoidosis, granulomatosis. But the most common cause you should not forget, that is the periural, perinasal, and parasinus and periodontal infection. This is the most common cause of cavernous sinus thrombosis. So, what are the investigation? What are the investigation we should do to find out the cause of cavernous sinus involvement? The clinical examination and sign we found from patient gives us clue to diagnose the cavernous sinus causology. So we can do complete blood count to see the any evidence of septicemia, that is raise ESR or CRP, and increase neutrophil count or WBC count. And then the most important thing to do the MRI of the brain to see the cavernous sinus in a T2 image or T1 image. Usually there is a concavity into the medial wall, but when there is thrombosis occur, it becomes ballooned up and the concavity is lost in the case of MRI finding. And in case of arterial involvement, that is internal carotid artery involvement, we can do the angiography, the gold standard test, the angiography. We can do the CT or MRI angiography. And in case of malignancy, we can do the investigation to find out the primary site. In case of cyst, we can do the cyst X-ray or CT scan of cyst, and we can do other blood tests in case of leukemia or lymphoma or lymph node biopsy. So this is the common investigation we can do in case of cavernous sinus pathology, and treatment is to usually according to cause. What is the cause? And then according to the cause, we can give the treatment. So up to this, in the next session or another day, we can discuss about the treatment option. So thank you, my dear friend, for your patient hearing. And if you have any comment, please let me know by commenting in my YouTube link. So thank you all.